Okay, good afternoon, everyone, and welcome to our 2020 CARES Act Telehealth Award curriculum launch. We are excited that you are here today. We're excited for today. This is a big day for families to learn for curriculum to be launched around telehealth for families. It doesn't exist, so you're going to learn all about it today. Before we get started, I just want to cover a few housekeeping items for you. So first, if you need closed captioning or Spanish interpretation, please look in the chat. There are instructions for how to access those services. And if you have any trouble, feel free to chat us so that we can assist you with that. Also, again, you'll see the chat function is enabled and is for our communication with you. So, you know, if you want to share something with us, please feel free to do so. However, if you have any questions, please enter them into the Q&A panel. You'll see the Q&A button at the bottom of your screen towards the middle. And we will be monitoring that box throughout the presentation. We may respond to some things in writing as we go, and then we'll have a formal Q&A session at the end. At this time, we are going to ask you to answer a very brief poll so that we can understand who you are and who is in the audience. And so when the poll comes up, please click the best answer. You'll have about 15 to 20 minutes, and then we'll share out who's with us today. All right, Ian, you want to go ahead and share the results? So 48% of you are from F2Fs, welcome. And we also have many of our other partners and community organization, individual families, and individual providers. So we welcome you all, and we are glad that you're here. So we are going to go ahead and jump in to our presentation. So before we get started, of course, I want to thank our funders. HRSA, as you can see, we were awarded $1 million from the 2020 CARES Act grant for family engagement around telehealth. So we thank HRSA. This curriculum would not be possible without their support. So this is a brief agenda, not quite so brief, but an agenda of what we're going to cover today. We'll do some overview of the project, talk about our needs assessment and how we got to the material that's in the curriculum. You'll hear all about the curriculum, some supplementary materials, evaluation tools, how you can get your hands on the materials, and other materials that we're continuing to develop for families as things are continuing to evolve and change with telehealth. So just to give you a quick overview of our project, of what we were tasked to do by HRSA when they tapped us for this grant, it really had 4 different parts to it. The first one really being to build the capacity of family-led organizations to assist families in this unique time with navigating virtual medical appointments, telehealth visits, as well as just receiving that support in a virtual format. The second piece, which we're here today for, which is why it's in red, it is all about developing a curriculum, disseminating that information, sharing it with families. And so you're going to learn more about that. The third piece was to develop partnerships in order to enhance who receives the material, to be able to spread beyond our network of F2Fs to other families out there that also need this access to this information. And then the fourth piece was to support a community of practice that really looks at what are those strategies and barriers that families that work and don't work for telehealth. So this kind of gives you it all in a nice picture. So when we thought about the project and we're tasked with these 4 items to have to do, how do we get there? And so, of course, to start out with the needs assessment, we wanted to understand what are the needs that exist out in the community, and I'll talk about that in a minute. And from that needs assessment, we moved to a telehealth academy that we launched and completed that included webinar sessions and interactive sessions with our F2Fs, again, to build that capacity. It's also to develop a curriculum, which you're going to hear about today, the nuts and bolts of telemedicine, to establish telehealth partners. Who are those people out there that are also doing this work? We can work together to make sure that families have access to this information. And we have 16 telehealth partners that we're working with who will share, help disseminate this information and educate families about telehealth. And finally, the community of practice piece, which we run 4 regional communities of practice, again, to uncover some of those barriers and strategies. So as I stated, we started with the needs assessment, and this is really important for you to understand how did we get to what's in the curriculum. And so with the needs assessment, we started with a national cultural liaison convening because we wanted to hear from those most underserved, often unheard communities to figure out what do they need? What are their concerns about telehealth? And how can we get them what they need? And so in June of 2020, we held a convening and we heard from people who work in those communities every day. And they shared with us that, first, the biggest thing that they need are materials to explain what is telehealth, how does it work, what are the options that I have, and we were responsive to that. The other pieces that we've looked at are the F2F capacity survey to understand what do the F2Fs need in order to serve families and deliver information to families. And the final piece is a family telehealth readiness quiz, which I'm excited to say we've heard from over 3,000 families from across the country and diverse families from our English survey, which we 33% of respondees were from diverse communities, as well as we have a Spanish quiz specifically that we heard from about 2,000 families there. And what we really heard was they had concerns about access to services, they had concerns about access to devices, and they had concerns about the security of their information and confidentiality. And so you're going to see how all of that comes together in this curriculum. So when we talk about the purpose of the curriculum, we wanted to, as I've talked about, we wanted to educate families. We wanted to increase their ability to access telehealth services, empower them to be partners, as we know that that is how you have the best outcomes for children, especially children and youth with special healthcare needs, and then get to that confidentiality and those concerns piece, like what are your rights and responsibilities in family-centered telehealth? And so just to give you an overview of kind of what is in the curriculum, it's 4 modules, so 4 parts to it. The first one is, are you connected? The second one is, do you have a device? The third one is, can you see your provider? And the fourth one is, that brings it all together, is your family's first telemedicine appointment. When you have that, all 4 have a pre-recorded webinar. You can use that webinar by itself, and we'll talk more about that later. But there's also some customizable PowerPoints in both English and Spanish, and I just want to touch on that for a brief moment. You will see that you can download those materials. The English one and the Spanish one look different. Out of our convening of the cultural liaisons, we developed a culturally responsive committee who are 9 cultural liaisons from across the country. They looked at every single piece of material that you will see and what we'll talk about today. And what we heard from them is it's not just translating language, it's also ensuring that the icons are appropriate and the colors are appropriate and the language is appropriate and the formatting and the videos. And so we were very responsive to that. And so you'll see that reflected in the differences in the English and Spanish versions, but both have the same content. The fidelity of the content is the same. It just looks a little bit different. And the final piece is the speaker notes. And what I'll say about that is you'll see speaker notes that really outline what's shared in the pre-recorded webinars, but there are also suggestions that came directly from our cultural responsiveness group, our cultural liaisons that we had looking at the materials that say, how do you modify this for diverse communities? As well as sharing information on what are those strategies for engaging families in this curriculum while you're presenting. So all of that will be shared. So now we're going to dive a little bit into each one of these modules so you can see kind of what we've done and what it's all about. And so I'm going to turn it over to Christy Weiss, who has been extremely instrumental in the development of this curriculum. So I'm excited for her to share with you what we've come up with. So Christy, I'll turn it over to you.
Thank you, Elisa. Thanks, everyone. It's been a pleasure to work with this group on developing this curriculum. And this is it, the nuts and bolts of telehealth, the essentials for a family-centered telemedicine experience. These are our Fab 4. We call them that because there are 4 modules to the curriculum, as Lisa mentioned. And we're going to start off with number 1, Are You Connected, in the orange circle there, and dive a little bit deeper to give you just a little taste of what is in webinar number 1. Go ahead. So webinar number 1 is, Are You Connected? And we really started at the basics of what being connected means. Being connected is an abstract term. When you think of internet and broadband, those are really abstract concepts. So we tried to make this tangible for families with the use of this dot to represent data. And we dug deep into what do different types of data look like, and how are those transmitted? And the idea of, are you connected to be able to send and receive this type of data? Next slide. We also developed this flow chart that's part of webinar number 1 with some really basic questions that family support organizations can ask families, such as, do I have a cell phone? Do I have internet or cellular service? And this leads you down a path to figure out if that connection is fast enough to support video conversation or video telemedicine appointment. Now, we know not all telemedicine happens via video, but this is one way to figure out if the family is connected in a way that they can do a video appointment with their provider. One of the objectives of webinar number 1 is to give some options for connection. We know that across our nation, across our territories, and across our reservation land, we are not all connected, and the connections differ from place to place across the United States. So this slide shows some options for those that might not have a strong connection or might not be connected at all, on where they can go in their community to get connected for a telemedicine appointment. Next, we have an objective in our first webinar about testing your connection, because it's great if you have a connection, but if it's not working, your telemedicine appointment's not going to work very well. So testing your connection, and again, figuring out how fast your connection is to see if it will support video is important. And so just a step-by-step guide leading families to a website called fast.com, where they can actually measure that is a part of this webinar. And last but not least, one of our other objectives is enhancing your connection. So you might be connected, but your internet might be spotty. It might be in and out. So some of the things on this slide, the 4 W's, if you will, wired versus wireless, windows versus walls, trying to highlight some things, small things that families can do in their home environment to enhance their connection, to make it stronger or better, so that they have a better, more successful telemedicine appointment, were some of the things we highlighted here. This is just a taste of webinar number 1, but should give you an idea of some of the things that you can look for in the Are You Connected number 1 of the Fab 4. That brings us to number 2 of the Fab 4, which is, do you have a device? This webinar really focuses on that device piece, whether that be a computer, a tablet, a phone. Go ahead, next slide. And again, we started at the very basics because not everybody knows what a device is. So as you see these circles pop up, this is part of the webinar, is to start by defining other words that families might be more familiar with that are devices, whether that be your iPad or a desktop, laptop, iPhone, Galaxy, Android. These are all devices, and we needed to draw those connections for people very early on with the terminology. Next, we divided these into 3 different categories, computers, tablets, and smartphones, because as you know, they're all devices, but they do things a little bit differently. And the response we got from the Cultural Responsive Committee was that pictures were really, really helpful. So we've added lots of pictures of these different categories and devices to this webinar, which we won't be showing here, but I'll encourage you to check those out on the website. And this is one of my favorite parts. This is in every single webinar. We have a family story. This particular family story for the device webinar is a palliative care example with children with special healthcare needs that mom shared this story with us that they received a telemedicine kit. And we included some quotes, next slide, some pictures and some quotes from the mom about how that was so helpful for them in connecting with their providers and providing care for their family. So you can look for these family stories in all the webinars, but this is just an example of one that's highlighted in the device webinar. And then in this webinar, we introduced the concept of tele-ready device. And so it's one thing to have a device, but if your device doesn't work, it doesn't have a microphone, and it doesn't have a camera, it's not tele-ready. And so these 3 things are the components of a tele-ready device. A working, powered on computer, tablet, or smartphone, plus a microphone that can be internal or external, and then plus a camera, internal or external. And we go into a lot more detail about these components, but just this slide introduces this concept of a tele-ready device and how a family can figure out if their device is tele-ready. Next slide. One of the other objectives for our device webinar was the testing of your device, specifically your camera and your microphone. So in this example, you can see we share with families how they can go to a website to actually test their camera. And then the next slide will show you that there's this same website that has a mic test as well, a similar website for the mic test as well. This allows families before the telemedicine appointment to check and see if their device is tele-ready and make any modifications that they might need to do to be able to see their provider and communicate with their provider. And as we did in the Are You Connected webinar, we also for the device webinar wanted to give options because we know that across our nation, territories, and reservation land, not everyone has a device. And so this is a huge barrier for families. And so this slide shares some options in their community of places, community organizations that might be able to help a family get a device that would enable them to do a telemedicine appointment. One other resource that we found and is highlighted on some of our barrier busters that we'll talk about later is everyoneon.org, which is an organization focused on this as well. So this slide gives some options for families who do not have a device already. Next slide. And that brings us to webinar number 3, which is Can You See Your Provider? And I want to just explain briefly why the C is in quotation marks for 2 reasons. Seeing your provider, we know we are working with families that have children with special healthcare needs, and we did not mean to be offensive at all to those with vision or sight impairment. So we have this in quotation marks because we don't mean it literally, we mean it figuratively. But we also know that many telehealth and telemedicine appointments across the country are not happening via video for a lot of different reasons, but you're not always seeing your provider. Some are happening via telephone. And so this webinar really was meant to try to highlight what families need to know to be able to get that video portion of their telemedicine appointment working. This has a lot to do with things called portals and platforms, and I'll let you go to the next slide so we can talk a little bit more about that. So as I said, how do you see your provider? One of the things we introduced in this webinar was the idea of needing software for your device to be able to see your provider. This software, as I mentioned, is often called a platform, and it's oftentimes accessed through a portal. These words can be really confusing, I think, for myself and many of us on the team, and for many families. And so defining these platforms and portals was important. Platform just meaning that software to be able to have that two-way interaction, and a portal being a place where you might access that software or log into to access your telemedicine appointment. So we dive deep into these two topics in this webinar, and we also give some examples, quite a few examples, and this slide captures that. Because there are hundreds of platforms out there that telemedicine is being done on, we wanted to give families a taste of some of the examples of ones they might hear the most. But literally there are hundreds, probably close to thousands of different platforms. So these circles here represent some of the most common, ones that families probably have heard about most often, things like Microsoft Teams and Zoom and Doxme, MyChart. But the idea here was not to be comprehensive in naming them all, but to just share with families some of the names of things that they might encounter as platforms and ways to see their provider. The other thing we introduced in this webinar was the idea of virtually opening an exam door. And what do I mean by that? As we all know, when we go to see our provider in person, we usually wait in the waiting room and are sent back to an exam room where the doctor is in or the provider is in. In this webinar, we tried to draw the analogy that you have to do the same thing when you have a telemedicine appointment. However, the difference is there are 4 keys that are needed for the telemedicine appointment. Next slide. And those 4 keys, you might be wondering, why are you talking about keys? When I go to see my doctor in person, I don't need a key. The reason we're talking about keys here is because of a very important point that Elisa brought up as part of the needs assessment, which was confidentiality. And so we don't need keys for our in-person exam room door, but for telemedicine or virtual visits, a key is necessary to protect family's identity and for the security and confidentiality purposes. So those 4 keys can be in the format of email, text, logging into a portal, or calling your provider. And we dig deep into all of these in this webinar. And speaking of that confidentiality piece, HIPAA is a huge question that can be really confusing for all of us, and I think even providers that work with HIPAA each and every day. But it's a law about health information, so we try to break down in this webinar a family-friendly version of what is HIPAA, or HIPAA what here, and talk about some of the things that HIPAA does cover and some of the terminology around it, like PHI, private and protected health information, and then some of the things that HIPAA will cover and some of the things that HIPAA doesn't cover as well. Next slide. And then we've added a little fun in here as well to be able to ask families, which is HIPAA compliant and which is not. So would you rather log into your children's hospital portal, MyChart, and have your telemedicine appointment that way, or would you rather have your appointment on TikTok? If you chose the portal, the MyChart portal, that is the more secure HIPAA version of that versus TikTok. And again, the other example we have here is Zoom versus FaceTime. Although during the time of the COVID health emergency, FaceTime has been used by providers because of some of the relaxed regulations. However, having a HIPAA compliant platform is preferred. And again, as we did in the Are You Connected? Do you have a device webinar? And also this one for seeing your provider. We want to give options to families who might be stuck and can't see their provider because they can't figure out the portal, or they can't log on to the platform, or they can't access the platform. And so this slide really gives some options for families, where things to say, things to ask for when they call their provider, or people in their community that might be able to assist them. Next slide. And another one of our objectives for the See Your Provider webinar was testing your platform. As you know, you can have a platform all day or a portal all day, but if you don't know how to log into it and you don't know how to access it, then that's not going to do you much good on the day of your appointment when it's time to actually see your provider. So we share some examples with families in here on how to test your platform a couple days before the appointment to make sure it's working. Next slide. And last but not least, this brings us to webinar number 4. I just wanted to make a note about webinars 1 through 3. When we were putting together the curriculum, we really felt that these webinars were foundational. If you don't have either any or multiple of 1, 2, or 3, a telemedicine appointment is not likely to happen for a family. If you're not connected, if you don't have a device, and if you're not able to access the platform or portal to get to see your provider, the chances of a successful telemedicine appointment are very low. So we felt these were very foundational webinars, and number 4 is really the culmination of those first 3. Having those first 3 things in place gets you to number 4 and the ability to have your family's first telemedicine appointment. So let's dive into that one. In this webinar, we really focused on family-centered telehealth. And this is a new term coined by Family Voices to mean a way of providing services through a variety of digital platforms that assures the health and well-being, this is the key part, of children and youth with special healthcare needs and their families through respectful family and professional partnerships. How is family-centered telehealth different than regular telehealth? This definition encompasses the key, that the family is at the center of that, and that it is in a respectful family professional partnership. So with that, we added some things in this webinar to really help define this and really help families understand what that means for them. Next slide. Part of the family-centered telehealth resources that were developed was a rights and responsibilities document that can be found on the website. These are just some of the highlights of what's contained in that rights and responsibilities document. Things like care via telehealth, plans of care, questions, and documentation. And these are written from a family perspective. Again, these are some of the responsibilities, just a couple of the highlights. Many, many more are included in the document itself, but responsibilities for a family to come with information to the appointment, their participation, maybe needing to assist with an exam, and questions that they might have. Next slide. And so now we're ready to jump into that actual telemedicine appointment. And as you guessed it, we have another slide with lots of different circles, because telemedicine appointments are not all called the same thing in different systems of care. So all these circles represent just some of the names that we gathered, from e-visits to e-consults to virtual care to online visits. This can all be so confusing for a family to know what they're actually showing up for virtually. And so defining this, we felt, was important from the get-go. Next slide. And we have a number of family stories in this webinar. This one in particular talks about a family's experience with language translation that's needed, the Santiago family in need of a Spanish translator. And we share some tips and tidbits on how this family story can be improved with the next slide by the need to ask for a translator accommodation in advance as making or before making the appointment, and help asking the provider if the translator is available. We have a number of different family stories in this showing other accommodations that might be needed, and we feel like this is one of the really key pieces of family-centered telehealth, is if there are accommodations that the family needs, empowering them to be able to ask for those accommodations and giving them tools and resources to be able to do so. The next part, we went into the actual telemedicine appointment, dividing it up in before the visit, after, during the visit, and after the visit, and next steps, and really walking families through each one of these so that they could get a taste for what they could do to prepare for each stage. Next slide. Family Voices has developed an amazing worksheet, both in English and Spanish, that really is a tool that a family can use to prepare and to use during the visit, the telemedicine visit. And so we've included that as a guide as we walk them through these different parts of the visit during the webinar. Before the visit, using that tool to document some of the things that they might need to gather, some of the notes they might need to make, during the visit, some questions that they might want to jot down, and then the next steps. And I want to pay particular attention, or ask you to pay particular attention to the text in red, because I think this is so important. Really empowering families during the visit, right at the end, to pause, make sure they understand everything, make sure they're comfortable with the care plan, ask any questions that they have before the visit ends, before you hit end on the Zoom call or hang up the phone, and then dive into some of the other questions and prompts that are here. But again, as I said, this worksheet is available for families to use to walk them through every stage of the telemedicine appointment. Next slide. And then this brings us to my absolute favorite part, which is the telemedicine bloopers. So we included video, actually we included video clips in all of the 4 webinars, but in this one we chose to pick out some bloopers of some telemedicine visits gone awry. So this is a little video clip of a practitioner that was eating during the visit. So the positive here is, do have a snack or eat before your telemedicine appointment. The way to avoid a snafu or a blooper is don't eat while you're on camera for your appointment. The second blooper there shows an interruption, taking another call during a telemedicine appointment. Do turn off your cell phone, and don't take another call or have another conversation while having that telemedicine appointment. This really gives us a chance to kind of poke a little fun at some of the things that may go wrong, but also help us all understand that life happens, and to possibly be prepared for some of that as well. And then at the very end, we end up with some video clips of telemedicine appointments done right in a family-centered telehealth way. And we won't show you the video here, but we'll direct you to the website and webinar number 4, so you can take a peek at a clip of what family-centered telehealth looks like being done right. And with that, I will turn it over to Kara to talk about some of the other supplemental pieces that have been made to go along with the curriculum itself.
Thank you, Christy. That was a really great overview and just a sampling and teasing of all the different fun and informative parts of the curriculum, for sure. So I'm tasked with the next 3 slides to just give you a quick overview of what these supplementary materials are. These are like documents, or as you were seeing already, the checklists and worksheets that professionals can use, providers can use, and families can use. The first one that I'll demonstrate in the next 2 slides are the barrier busters. Right now we have those in English, but they're coming in Spanish. And also on the website, you're going to find the Family-Centered Telehealth Declaration in full, and that's in English and in Spanish. And then also there's a separate document that's the telehealth rights and responsibilities, and we have that in English and Spanish as well. We also have this really amazing glossary of telehealth terms. There's a lot of things, as you can just see a little bit from the demonstration of parts of the curriculum. There's a lot of terms, there's a lot of images and stuff to keep track. And so we'll have this really great glossary that you can use on the side and, connected with the webinar, but it also can be printed out, which, for those of us who still like that hand copy, it's there for your hands. There is the telehealth checklist. I'm having trouble speaking this afternoon. Apologies. Checklist and worksheet that's available in English and in Spanish. It's kind of going back to the wonderful care coordination notebooks and binders that families have cultivated for years. And it's just giving some, current usages in telehealth. Perhaps we're not having to travel to the appointments as we used to, but now maybe you can find some time, the 10 minutes that you weren't traveling, to organize yourself and figure out what you want to get done. And the importance of the family-centered telehealth and the rights and responsibilities in these checklists and worksheets, what we were really thinking about is that telehealth is not a new thing, but the extent of it is definitely new, and it's amidst a pandemic and everybody is still reeling and trying to recover. But, telehealth, we hope, is going to stay around, and it's going to change and make sure that it becomes family-centered and meets the unique needs of each child and family. And so we want to make sure that we're not just having it as a substitute for an in-person visit, but that we're thinking about how can we make the things that happened in an in-person visit that were important to getting to that shared decision-making and making a shared plan of care into an actual telehealth appointment. So it's really to empower, but to also get us all to think together about how do we do a shared plan of care through a telehealth appointment and really work together on things. And then the other supplementary materials you'll find on the website are a social media toolkit. Next slide, please. So just to quickly demo a little bit about the barrier busters. This is an example on the left. And on the right, you'll see these are organized by each of the barrier busters that correspond with the 4 webinars. But you'll see the example here on the left. I can't do my telemedicine appointment visit because I don't have a signal. I'm sure everyone has heard that or experienced it or whatever. And so we designed these sheets to really help people break down, okay, what does that mean? I don't have a signal, back to that basics and building capacity to understand more about technology. And I can admit wholeheartedly, I learned a heck of a lot about technology because I am not tech savvy. It's been really amazing for me to learn and be a part of this. But so if I don't have a signal, then who can help me? Where could I go? And then what are the next steps? What do I do about this? And where can I learn more? Really linking and driving families to, we call out problems and issues and barriers all the time, but making it positive. Let me learn about this and figure out where I can go more and find somebody to connect with. So that's just an overview of all of them. And then on the next slide, we're going to show you that we've made 14 of these really based on sort of all the major barriers we've learned about from our CRC, from our staff, from our network of family-led organizations. But then on the next slide, you'll see that we also just, in the spirit of the webinars, that are recorded webinars and you can use and show as is, or there's unbelievable ability to context and modify depending on who you're serving and reaching. And so we wanted to give you this template really for customizable barrier busters where you can fill in any other barriers that you come across with families and you want to have, present in these barrier busters to send them over email so they have on their phone and they know what to do, or print out and hand out in a visit. And then you can also customize the back of it for your state and local telehealth resources. So that's a quick overview of the supplemental materials that you'll find on the website. And I'm going to hand it over to the marvelous Mary Jo Palladino to talk about evaluation of all this great stuff.
Mary Jo, I think you're muted.
Is this better? Thank you. Yes, evaluations will be provided. We've got 2 types. There are evaluations for the F2F staff to complete, as well as the families participating in the training. You'll receive slides that will include the links and QR codes for that. And the evaluations are available in English and Spanish. And we do look at the evaluation information. We feel like the material is strong and good, but with input from those who participate, we can make it even better. Next slide. And I know we've had a couple questions about the materials and where to get them. The access to the materials, here's a QR code and a link. All of the telehealth information is on the website under the telehealth section and in the F2F portal. And now I'll turn it over to Elisa.
Thank you, Mary Jo and Christy and Kara. So just to let you know, you can take your phone, you can scan the QR code now, you can go to the website. Everything that we've shared so far is uploaded there so that you can look at it while we're talking about it, as I share a few other pieces with you as we go forward. So, all right, so how do you use the curriculum? How do you get it out to your community? How do you engage? And so we thought of some, these are 6 options, but certainly your community, how to tap into families, how best to reach them, especially as we've gone through what's about to be a year, can you believe it, of a pandemic, of what we need to do. And so the first one is really looking at hosting those virtual workshops, whether it's through using Zoom, setting up a workshop, sending out a flyer in order to share this with families of children and youth with special health care needs. If you are not an F2F or another family-led organization that we've partnered with, then please go and partner with them. The two of you coming together with your perspectives and your communities, bringing them together to really share this information that's in this curriculum could also be very powerful. There's also the rule of 4. So as you can see, 4 is a huge theme throughout this curriculum. And so the rule of 4 is that there are 4 webinars available that you could essentially do it over 4 weeks, 4 days, 4 months, whatever works for you to split them up, or you can just focus on webinar 4. One of the pieces that I'll share about webinar 4 is that we also go back through and bring people through 1 through 3 to really help them kind of tie everything together of how do all of these pieces fit. So if you have one shot with families, webinar 4 could be your go-to. And if they want to dive a little bit deeper, you can direct them to the pre-recorded webinars. Another option is to connect with local support groups of children and youth with special health care needs. We know that's where families are and that's where families get their information. And so connecting with them to do a telehealth night with them could be great. And especially as we know that families that have children with special health care needs are utilizing telehealth, at an exponential rate. The other pieces, the 5th one would be kind of your local libraries, schools, community organizations. Everywhere I go and every person I talk to, this is what they're talking about. The schools are using telehealth to deliver services to children. The local libraries are trying to figure it out. And if they're not open, a lot of them are still running some virtual programs that you could engage with them and talk to them again about having a telehealth night to really share with families what telehealth is. And the final suggestion is to share the webinar recordings with families of children and youth with special health care needs. This information is available on our website. It is available to you to be able to, if you would like, to be able to put, on your website, of course, with information from Family Voices that, that you're sharing our materials. But it's an opportunity to share a recording with families that may not have time to come to a virtual session or aren't engaged with some of these local support groups, but could use this information. So with that, it doesn't stop. things are continuing to evolve, as we all know, and we're learning so much about what the needs are as we move through these times, and telehealth takes a greater presence in our communities. And so a few things that we want to let you know are on the horizons. The first one being a video of telehealth visits. So we are working with the California Telehealth Resource Center to develop 4 videos that actually follow a family, an actual family that has a child with a special health care need through various types of visits, including ABA visit, a visit with a speech therapist, a group therapy session, and then hearing from the parents about how they've helped their child to navigate these times. So be on the lookout for those. They are in development and being edited, so they should be out in the next couple months. I'm going to have Mallory share with you, Mallory Sear share with you information about youth-facing materials that we're working with CT CASA and YASA on.
Sure. Thanks, Elisa. So one really important component to the telehealth work has been, we're getting input from families, we're reaching out to underserved communities, but another big population of people who need to be engaged and who are accessing telehealth right now is youth. And so we've talked a lot about youth engagement here at Family Voices. And so instead of going into a group of youth and telling them what we think is important and kind of driving the process, we really created a process for them to drive it. And so what Family Voices has done is partnered with YASA, Youth as Self-Advocates, which is a program of Family Voices, as well as Connecticut CASA, the youth advisory through the Connecticut Family to Family. We formed a work group, and they will be responsible for creating youth-facing deliverables on the topic of telehealth. And we had an introductory call with this work group where they brainstormed topics that they felt were important to youth and how the information should be presented. We provided some options like a video, a webinar, and that kind of didn't resonate with anybody but us. And they agreed to do 3 social stories, one addressing what they're calling a myth buster about the topic of telehealth, one explaining what telehealth is, and the third covering caring about your mental health during quarantine. So this group is meeting, YASA and CASA, together with a total of 23 youth who are giving input. The work is being divided between the 2 groups, and these final materials will be shared on our website as well as disseminated in the coming months. So we're really excited to have, created this opportunity and to see what comes of it. And they have been so excited about this topic and working together that this, is probably just the beginning of some youth-facing telehealth materials as well.
Thank you, Mallory. And so I will just give you the last few things that we are developing, and as our wheels continue to turn, it could be more. But as all the staff shakes their head at me, but we're looking at developing a family-centered telehealth infographic. It'll essentially take that information that we have in a family-centered telehealth document already on our website, and it'll put it into an infographic that can be much more accessible for families who that language may be a challenge. We're also looking to develop a telehealth 101 infographic, and I'll just say with that, we heard from our cultural responsiveness group, like we kept giving them the webinars, and they were like, they just need to know what telehealth is. So here we are, and we are, always ever responsive. And so we will be developing a telehealth 101 infographic for families. The barrier busters, all 14 of them will be translated into Spanish. They are actively being translated, so we expect them out momentarily. And then the glossary of telehealth terms as well will be translated into Spanish so that Spanish-speaking families also have access to the definitions of all of the terms that we cover in the curriculum. And so with that, we've given you a lot of information. And so we're going to move to question and answer. And so we have Mary Jo, and I think
Yes.
Connie are going to share some of your questions that you put into the Q&A.
Thanks, Lisa. Yes, we have a few questions. A couple questions about the length of time that the curriculum is.
Okay. So I can take it, or Christy, you're also welcome to chime in.
Yeah, this is Christy. I just typed the answer to that. So webinar number 1 is the shortest at 26 minutes. And then the webinar number 4, because it is a compilation, as Elisa said, a review of 1 through 3, plus the real life telemedicine experience, it is 50 minutes. So they're all under an hour, but range and vary. Each webinar's different time length.
This is Kara. Sorry, if I can just add in there on that, just the reminder too, that that's how Christy has recorded them. But you know, what you're getting access to is PowerPoints that you can break down. You know, we heard some in there through the speaker notes, that sort of guidance of, if you are preparing this and showing this to this community, you may want to look at making this a 5-minute presentation. And so you can use the pre-recorded, or you can break it down and make it what you want.
Thanks, Christy. Thanks, Kara. Another one maybe for you, Christy, the slide that mentioned the telemedicine kit in the social story, a question about where did the funding come from for the kits?
Yeah, and I just typed an answer to that one as well, and I'll ask Kara to help me out with that one. But I believe that was funded through the palliative care company and the home health company that was doing that care for that family.
Yeah, it's Capital Caring Palliative and Hospice Care in the DC metro area that does it. And they also have a different hospice over in California that uses it as well. And it's part of their program to have that kit. And the program funds it right now.
Thank you. Elisa, this one may be for you or Beth, if she's still on. Asking, we would need to have 2 webinars, correct? And could we do webinar 4 2 times, or do 2 that fit the needs of whomever we are presenting to?
Yeah, so that's a great question. You can do any 2 that you want. Like we said, 4 is very comprehensive. So if you feel like hitting families, you know, twice with number 4 is the direction you want to take, you know, the families in your state's best, you know, and I think that's fine. If you feel like access is a huge issue in your community, that may be one that you want to focus on, and then do number 4. So you can do whatever combination or repeat one. It's totally up to you. There is no formula of what you have to do.
Thank you, Elisa. The next question, what about a social story for children with communication challenge?
Yeah, and I'll touch on it a little bit, and Mallory, certainly feel free to jump in. So the socials, when we talked to the youth, this was their first question to us. They said, what about those that, I mean, all of the youth that we have, most, I'm not going to say, no, it's not all. Most of the youth that we have are able to communicate verbally. We do have a couple of youth that communicate using assistive technology devices, but all of them, the first thing they said was, you have to think about the kids that have communication challenges. And this is why we want to create social stories. They were very intentional about using icons from PECs. They were intentional about using, so they have their finger on the pulse of that. And we were like, absolutely. So that is something that, that is being worked into the social stories that they're developing.
Thanks, Elisa. This next question is an accessibility question. Have you looked at how accessible these documents are for people with disabilities? People with disabilities, for various reasons, are experiencing some of the greatest health disparities, and in certain age groups, have less technology access. I would be happy to offer guidance in that area. And this is Catherine Hayward.
So thank you, Catherine, for your question. And so at first I want to share what we heard. We call them the CRC, so I don't have to use cultural responsiveness committees alone. So the CRC, they raise these same concerns. And what we've heard from them is that they're, these PowerPoints are, again, they are customizable. You can take them and print out the speaker notes and go and sit and have a conversation with someone that this may be a challenge. Or you can customize it to take pieces of information to share that's developmentally appropriate. The other thing that I will share is that I will say the Spanish version is probably a little bit simpler in its delivery. So that could be, a potential option, but I want, first of all, we would love to hear from you about your suggestions on accessibility and your thoughts on that. So please put your contact information in the chat. But the other piece is that these can be delivered and customized for various communities that you want to use it with.
Thank you, Elisa. If you have a way to track hits and engagements for data reporting purposes, can the recordings be uploaded onto our website for families to access and view at their own pace and time?
Yes. So first of all, if you work for an F2F, you already have access to the pre-recorded webinars. You can take them from the F2F portal. You can upload them on your website. That way families can view them. As far as on our website, it's also there. So families, you can provide a link to that for families on your website. So again, they can watch those webinars. So, and that was a lot of the idea behind the webinars is really twofold. One, it's a train the trainer opportunity for if you're not familiar with telehealth and you want to deliver these trainings, it's an opportunity for you to kind of watch live in action. How would I deliver this? But also it's an opportunity for families to be able to view, like you said, for those that don't have the time or the ability to either, they can watch it at their own leisure, their own pace, rewind, go back, whatever they need in order to be able to engage with the materials.
Thanks, Elisa. Next question, given that many families have had teleservices since March 2020, do any materials here include how to advocate for greater quality of service, proficiency of staff assigned, etc.?
Carrie, you want to talk about some of the materials on kind of like rights and responsibilities that we've developed?
Yeah, I'm sorry, Mary Jo, can you read it again? I was typing an answer to a different one, so I heard parts.
Okay.
Of course, right?
Right. So given that many have been using teleservices since March of last year, are any of the materials included on how to advocate for greater quality of service or proficiency of staff assigned?
Yeah. We don't, it's the main documents, sorry, I'm trying to organize my thoughts. The main documents, I think, where we're thinking about those things and sort of giving, putting some things in writing about them and thinking of the empowerment part of it and the discussions that need to happen are the Family-Centered Telehealth Declaration, the rights and responsibilities, as well as the telehealth checklists and worksheets. Some of the checklists and worksheets have been out for a little while on our website, and there's a shared decision-making sort of worksheet there as well. It's not that we explicitly call out like, here's how to advocate for some better people, but when you look through the worksheet, you'll see that it kind of flows through that. Like you can use it while you're going through your visit, but you can also use it beforehand. And perhaps, if you're working in an F2F or a Title V that's doing direct service, or you're in a provider's, role of some kind, you can walk through a worksheet with a family ahead of time and say, okay, let's think about who do we want in this visit? Is your home health nurse going to be available? Are they coming into your home? Are there any other providers that somehow we could have come together? Is this a family meeting situation? Is your youth participating? You know, just beginning to think about, and also, you know, and sort of the planning and that pause part of that Christy highlighted is just how to get more out of the visit and make sure, you know, we all have left, I'm sure, visits before in person where we're like, oh my gosh, I forgot to do this, or, you know, I don't know who's doing this or what. So hitting that red pause in a telehealth too, and making sure that you've gotten what you needed. And one of the sort of pause things that we triggered in there that I'll highlight is that initially we heard a lot of families saying, you know, I don't want to go back to an in-person visit right now for XYZ PDQ reasons, but I'm not sure how to say that to my doctor, and the health system's requiring it. But just sort of giving some ways to trigger to have some conversations about, let's plan out. If I'm seeing you every month for 4 months, can we alternate? Let's talk about this in a shared decision way, and listen from the provider perspective of, I need to lay hands on your child. So can we do it, you know, every other month, or, you know, just sort of getting to that more, how do we make these visits work better for us? So we've started it, I think, with those documents, but, you know, as we're asking for all kinds of feedback, if you get ideas when you're working through and using these things with families, let us know, let me know, and we can figure out how to gather that data and move it forward. Sorry, that was a longer answer than you probably wanted.
Yeah.
So
There
it's
are about five more questions. Do we have time? We'll go
so-
quickly.
So we're at time, but what I
Okay.
say is we can provide those answers. We have that information. Everything's been recorded, and we can share those answers with you via email. What I want to encourage is, if you want additional information about these materials, if you would like us to have your contact information, please drop your email address in the chat so that we will have that, and we can have staff reach out to you to, you know, find out either how we can connect, how we can partner, share information on telehealth going forward. So thank you for your time today, and we hope you enjoy the materials.
Thank you.